So my research team started working with migrants in the area of HIV/STD prevention, as George just mentioned, since 2001. So in the last 13 years, we are working, we continue working in the area of HIV/STD prevention among migrants population. So we did several phases. We did feasibility study, we did a pilot intervention, we designed the intervention program. But in 2001, we were lucky to get involved with this particular migration and the health in China project. So two of the chapters I'm involved are related to mental health. I'm a psychologist by training, so naturally that was the area I would like to make some contribution. Actually, over the years, when we were working with migrants on HIV/STD prevention, we also kind of, get grant support to study the mental health issues among migrants. So then, in this project, we pull 7 or 8 scholars from different institutes in China to get the data they collected, or they were collecting at that time from different areas, different populations. Try to answer 3 questions. So the first question is whether migrants really doing worse, or compared to their counterparts, in the urban area or even in the rural area. So then the second question is, what's in the process of migration? What's the factors in the process of migration that's associated with their poor outcomes, mental health outcomes? Then the third question, we want to look at any individual factors or contextual factors that can mitigate the negative, if any negative impact from migration. Any individual factors or contextual factor can mediate such a negative impact. So the first chapter we did was looking at migration, the migrants. So basically migrants in the urban area and their children in the urban area. So we have 4 relatively large data sets from 3 urban centers in China. So 2 of them from Beijing, 1 from Shanghai, another from Chengdu. So collectively involving more than 5,000 samples in those 4 data sets. So we have in one of the data sets, we have migrant sample, we have urban kind of comparable urban population sample. We also looking where those migrants come from. So we found out 85% of the migrants come from A province in China. So we sent, the team go to those A province, collect the data from rural population. So try to get a comparable sample to look at their mental health status and other factors. So then we also looked at the children in Beijing, the migrant children, the children coming with parents into Beijing. We're looking at their schooling, at different schools, children at the migrant children's school, also the children at the public schools. So in the second paper, we were looking at the left-behind children. We have 2 also relatively large data sets. One is from Ningxia province. That's one of the remote province in China. So we have another set from Guangxi province. Also, the Guangxi province, we have longitudinal data. In short, I just gave the scope of those papers, those studies. The stunning finding is, regardless what population, what the sample we have, where they come from, what the measurements of mental health we use, what's the analytical procedure we use. So all the findings are consistent across the sample, consistent, between the migrant children, left-behind children. So we also show very general in 3 areas. So number 1, the migrants and their children. Either the children they brought to the city, or the children they left behind. So they are performing, or report poor mental health outcomes. Even also in one of our data sets, the Ningxia data set, we have physical measures, we have nutrition measures. So their status compared to their counterparts, the children with family, with parents not migrating, so they show poor outcomes. So then we also find out, number of the factors, factor during the migration process or during the parental migration process are related to those poor mental health outcomes. Then also we find out a number of individual contextual factors, from different studies that can mediate the negative effect of migration. So based on our study, so we learn a lot from those, two book chapters or two work. But we do see some knowledge gaps. So number one, is lack of longitudinal study follow-up. So in the 6 data sets we have, only one have a 6-month follow-up data. So definitely, in order to look at the impact of the migration, just like Sufang and Joe showed, migration is a process. So we need to assess the impact at different stages. So we need to have a longitudinal study. The second thing is, in terms of mental health, we are lacking biomarkers. We are based on self-report. So we all understand, some self-report bias, during the survey. So we need to develop or employ biomarkers in the future study. The third area we fear is lacking is the intervention studies. The migration in China has been going on for 20 years. Our individual team has been studying this population for 13 years. We feel like we need to put our knowledge into action. We need to develop, intervention programs or policy implementation programs to help those migrants. So right now, a lot of study, particularly in the mental health area, is still in the stage of assessment. To learn, they are doing good. I guess we know most of the answers, but we need to transfer our knowledge into actions. Then another area we actually touched in our own study, HIV STD study, we touched the return migrants. Again, following the framework, we need to see how those migrants, when they stay in the city for a certain time period, when they go back to the rural area, what happened to them, what happened to their family, to their peers. So that's also is an area we need attention. So in terms of the policy, we feel so far, in terms of the system factors, the whole code system in China, the dual household registration system is a big system factors that created a lot of discrimination, or created a lot of unequal treatment on the migrants. Then also the stigma associated with their status, the status related, also their education, because they come from rural area, they are poor, they have low education, they have accent, so it's the status related to stigma is a big factor. Then the other system factor is the protection, the government policy or the government legislation. I'm sorry, protecting the migrants' basic rights in the urban area. So I think that Chinese government has trying to do something over the last 10 years, gradually make the situation get better. But I think we need to do more to make the migrants can get what they entitled to. So I just stop here. So we'll be happy to answer any questions.